Imiquimod, also known as Zyclara Cream in meter dose pump, is a topical immunomodulator that is used to treat actinic keratoses, AK, which are precancerous growths on the skin caused by too much sun exposure. Treating this condition can decrease the risk of complications from them. Imiquimod belongs to a group of drugs called immune response modifiers, and it is believed to work by helping your immune system to fight these abnormal skin growths. It is important to use this medication as directed by your doctor and to apply it at the same time each day. The usual dosage is a thin layer of cream on the affected area before bedtime, and it is important to wash your hands after applying the cream. Be sure to follow your doctor's instructions for the best results. Before you start using Zyclara Cream, make sure to read the patient information leaflet provided by your pharmacist. If you have any questions, ask your doctor or pharmacist for guidance. This medication is meant for use on the skin only. Apply it to the affected area once a day for 2 weeks as directed by your doctor. After that, give your skin a break for the next 2 weeks by not applying any more of the cream. Then, you can start applying it once a day for another 2 weeks. Avoid applying this medication in the eyes, nose, mouth, rectum, or vagina. If you accidentally get it in these areas, flush with plenty of water. If you experience irritation, talk to your doctor immediately. If you are using the pump, make sure to prime it as directed before using it for the first time. If you are using the packet, use a new packet of cream for each use and discard any partly used packets. Use this medication regularly to get the most benefit from it. Try to use it at the same time each day to help you remember. Before applying the medication, wash your hands and the area to be treated with soap and water, and dry thoroughly. Apply it just before bedtime and wash the treated area in the morning with soap and water to remove the cream. Do not bathe or wet the treated area before the prescribed application time has passed. Also, do not use more Imiquimod than prescribed or leave it on longer than prescribed, as doing so increases the risk of severe skin reactions. If your condition lasts or gets worse, or if new growths appear during treatment, be sure to inform your doctor. When using Zyclara Cream, you may experience reactions in the treatment area such as redness, swelling, itching, burning, pain, thickening of the skin, peeling, flaking, or changes in skin color. If any of these effects persist or worsen, consult your doctor or pharmacist. In severe cases, such as bleeding, sores, or ulcers, your doctor may need to temporarily stop the medication to allow the skin to heal. You may also experience side effects such as dizziness, diarrhea, back pain, mouth sores, swollen lips, or flu-like symptoms. If any of these effects persist or worsen, consult your doctor or pharmacist. Remember, this medication has been prescribed to you because the benefit outweighs the risk of side effects for most people. It's important to seek medical attention immediately if you experience swollen glands, new unusual skin growths, or signs of a serious allergic reaction such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so consult your doctor or pharmacist if you notice any other effects. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using Zyclara Cream, it's important to let your doctor know if you have any allergies or if you have a history of medical conditions. This medication may cause dizziness, especially when combined with alcohol or marijuana, so it's important to avoid activities that require alertness until you know how it affects you. It may also make you more sensitive to the sun, so it's best to limit your time outdoors and use sunscreen and protective clothing. If you are planning to have surgery, make sure to inform your doctor about all the medications you are using. If you are pregnant or breastfeeding, discuss the risks and benefits of using this medication with your doctor. When using Zyclara Cream, it's important to be aware of potential drug interactions that could affect how this medication works or increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Additionally, do not apply this product on the same area of skin with other Imiquimod-containing products. This could lead to unwanted side effects and interfere with the effectiveness of the medication. Be sure to follow these guidelines to ensure the safe and effective use of Zyclara Cream. If this medication is accidentally swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms such as fainting or difficulty breathing, it is important to seek immediate medical help by calling 911 or contacting a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Do not give this medication to anyone else. Make sure to keep all your scheduled medical appointments. If you forget to use the cream at the regular time, you can apply it as soon as you remember. But if you remember the next day, then skip the missed dose and continue with your regular schedule. Do not use a double dose to make up for the missed one. It's important to store Zyclara Cream in metered-dose pump topical immunomodulator at room temperature and keep it away from freezing. Make sure to store the pump upright and out of reach of children and pets. When it comes to disposing of the product, do not flush it down the toilet or pour it into a drain unless specifically instructed. Instead, properly discard the product when it is expired or no longer needed. It's best to consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.